Hey there. Welcome back to another episode of Covering Your Health, or welcome for the first time if this is the first time that you have ever listened. This is Covering Your Health. I am Evelyn Erives, your host, and we're back with another fact-filled episode. I think that you're going to get a ton of information out of. This is a really special one because I always say that. I know they're also special, but they are special to me because I learn so much with every single episode. I'm just like you. I'm learning every single time. And this, I feel like, is one of those episodes that no matter the age, the information that you're going to find in this episode is valuable, so valuable. Emergencies affect everyone. And you may have heard the word Narcan used a lot and fentanyl used a lot. We're going to talk about some of those things that are in the headlines right now and how you can keep your family safe. Today, we're joined by Kelly Smith. She's a trauma nurse coordinator with Riverside University Health Systems Medical Center in Moreno Valley. She's going to talk all about her career, Narcan 101, her passion for education. Oh, there's a lot of fun stuff about that, and so much more. And before we get started, I want to tell you a little bit more about our guest. In addition to her work with Riverside University Health Systems, she's also a mother of two, an avid scuba diver, a world traveler. I mean, she's worked on mission trips to Kenya, Fiji, Guatemala, Nigeria, and her Stop the Bleed certification course has really caught the attention of doctors, nurses, first responders, and so much more. You can tell she's very passionate about Stop the Bleed. She also has a passion for educating the public on fall prevention, car safety, and reckless and distracted driving prevention. The list goes on and on. She is an expert, and I'm so grateful and very excited to welcome her, such a busy, knowledgeable young woman, to our little Covering Your Health family. So let's get into it, shall we?
Welcome to Covering Your Health, a wellness podcast dedicated to covering all areas of living a healthy and happy lifestyle. From healthy hearts to understanding health plans and everything in between, each episode will provide you with a better understanding of managing your health, preventative care, and staying on the right path for your family's wellness journey. The Covering Your Health podcast is presented by IEHP. Now, your host, Evelyn Erives.
All right, well, let's welcome Kelly. Hi, Kelly. How are you?
I'm doing great. Wonderful to be here. How are you?
I'm fantastic, and I'm so happy to have you here. I know this is going to be a very special episode. Let's start at the beginning, though. I want to know about you. Tell me, how did you find yourself in this line of work? Did you always know you wanted to be a trauma nurse?
Well, it all started a long time ago. I was a waitress for about 10 years prior to being a nurse, and there I really learned to love to serve people, and I love the fast-pacedness of it, but I knew I needed more of a career to kind of expand my reach to people. So I decided to go into nursing, graduated from RCC back in 2009.
So you went to RCC? That's so cool. Local right here.
Yeah, I sure did. Yes, graduated from there. As I was going to nursing school, I decided I needed to get into the medical field, so I started as a phlebotomist, went to phlebotomy school, actually did my internship at Riverside University Health Systems, got hired on as a phlebotomist there. As working there and going to nursing school, I really realized that I wanted to work at RUHS. I really valued their mission and the care that they were able to give to the community. And so right when I graduated from nursing school, I got a job there. 2009, working on a med-surg floor.
And did that passion start for you really young? Did you know you wanted to be a nurse?
I did. I knew I wanted to be out there helping people, doing something that I could care for somebody, always learning and growing.
Yeah, no, for sure. And did you grow up here in the Inland Empire?
I did. Born and raised in Southern California. Grew up in Riverside.
Nice. That's awesome. Well, let's get talking about your role as a trauma nurse coordinator. Obviously, that's a big title. For those who are unfamiliar with this type of role, can you kind of share a little bit about what your everyday work life looks like?
Certainly. So as working in the trauma department, I do what's called injury prevention. That's my main title. That's my main role. So as a level 1 adult trauma center in the Riverside County, it is our obligation and duty to not only treat the person with the best, most quality care when they're in the hospital, but also to help prevent them from coming into the hospital by educating them, providing them resources to help keep them safe and out of the hospital. So that's kind of my job. I wish there was an everyday, this is exactly what I do. It seems to vary.
I imagine.
Mm-hmm.
Yeah, I bet it's very different every single day. You don't know what you're going to get yourself into in any
Including
scenario.
podcasts, yes.
Including having to join me on a podcast. That's so true.
Yeah, but really, my goal is to analyze our data. Why are people getting injured? How are they getting injured? And then research some evidence-based programs out there, and then implement them into our community. Education, that's what it's all about, education and prevention. A lot easier than treatment.
That's so true. No, the more you know, right, the better you can behave, and your actions will hopefully follow through on that once you know better. For those who don't really follow the news, obviously there's been a huge increase in opioid use in both Riverside and San Bernardino counties. Can we talk about opioids? What are they for those who don't know?
Sure. So opioids are a class of medication that's used for pain relief, and when prescribed and used correctly can be safe to manage pain. It's when they are not used and misused, when they're taken in excessive, when they're taken not for pain, that's when they become a problem and becomes a huge issue for our community.
Yes. Now, is fentanyl an opioid?
Fentanyl is a type of opioid, and when administered correctly is safe, but we have noticed that it is being incorrectly manufactured. It is being added to other medications and other drugs that normally does not have fentanyl in it. And even a tiniest bit of fentanyl that's placed incorrectly can actually lead to lethal overdoses, which is why it's been such a huge problem in our community.
We've all heard the ads now at this point of, trying to help people prevent themselves from having a fentanyl overdose, and understanding that it could be in regular drugs and things like that, which is just so scary.
It really is. Yeah, I think fentanyl has such a bad connotation now, and so people stay away from using fentanyl. But what we noticed that people are still using some of their other drugs, whether it be heroin, or sometimes they take a not correctly prescribed Xanax, or like some of these black market medications that they think are very benign and that wouldn't think to have fentanyl in it. But we know that fentanyl is being added to a lot of these kind of drugs that are being sold, and then leading to huge overdose.
Yeah, that's so scary. Oh my gosh. So how are people are you finding this information out? How are people getting their hands on opioids if they don't even have a prescription for it?
Right. And they're getting it on the black market. They're getting it from their friends, from their dealers, just like they would get any kind of street medication or drugs. That's how they're getting a hold of it. And unfortunately, the way that fentanyl works and the biodiversity and the availability of it can cause the medication to be very unstable and lead to lethal overdoses very quickly.
Are you seeing this with all ages, or is there like a targeted demographic that you're finding is using or abusing opioids more?
So with the opiates, it's more, any kind of illicit drugs and stuff that people are getting their hands on that's causing overdoses. And we are seeing it in younger and younger populations. Kids getting a hold of it from their other friends and stuff, not realizing that it's fentanyl. Maybe they're taking it as like a stimulant so that they can study for a test, or that they're very anxious, so they're taking something to help calm them down, and not realizing that it's cut with lethal doses of.
Wow. So how can we keep our loved ones safe from really accessing opioids, even if they're prescribed to them?
That's a good point. we can't prevent all of them, right? But what we can do is educate. We really need to have those conversations with our loved ones, our family members, our children and stuff about the dangers of illicit drugs of all sorts, right? And the facts behind it. If you are prescribed an opiate and maybe you have a high-risk family member in your house, you can lock the medication or hide it and stuff so they can't get to it. But really, I think the key is education and having those conversations so our children and our family members make the right decisions every single time.
Right. Education is the key right there. So what are the signs of an overdose? Let's talk about that, because I have, thank God, never seen anyone overdose. But what does that look like? I know you as a trauma nurse, you've probably seen that before, right? Many times.
I have, and it's terribly scary. The person is usually very lethargic. They're unresponsive. They're not waking up when you're calling them. They are breathing very shallow. They're breathing very slow, or they're not breathing at all, which can turn them colors and shades of gray and blue. Sometimes there's like this bad snoring respirations, we call it. And then also, if they are exhibiting signs of respiratory depression like that, if you look into their eyes and they have their pupils are pinpoint, that is a classic sign of an opiate overdose.
Oh my gosh, really? That sounds so scary. Oh my goodness.
It is, especially when you come across that on your loved one or your child or something that has succumbed to this. That can be very scary. So that's why it's so important to know what the signs are and know what you're looking at so that you can act immediately. Call 911, administer the naloxone if you have it.
Now, is that the same as Narcan? Is that what we're talking about here?
Yeah, Narcan and naloxone are interchangeable and stuff like that. And it is the medication to help reverse any kind of opiate overdose.
I've heard a lot about it, so I'm super curious about it. I'm glad that you know about it. So this drug particularly helps reverse the effects, like you said, of a potential opioid overdose. And it does it in minutes, right?
It is almost immediate. It's an incredible medication to give. You almost feel like like God when you're giving it, because here they are, very unresponsive, not breathing correctly. You give the medication and they just kind of hopefully pop right back up, start breathing much better, and kind of have their symptoms resolve. Yeah, it's a great medication. It is sound. We can give it a couple different ways, but for the public, what we do is we give it intranasally, so in the nose. So they come in little unit doses that you can get over the counter. You can get it for free, as well as you could buy it at CVS or any of your drugstores. And what you do is you come across somebody that you suspect is overdosed or is not responsive, not breathing correctly. You're going to call 911. You're going to take your that medication, put it into their nose, and then you just push the little plunger and administer the entire dose of the naloxone in their nose. Sometimes one of the side effects of the naloxone is that they can become a little bit agitated when they come out of their haze there. So the wonderful thing about the naloxone is that if it is opiate overdose, it will save their life. If it is not, there's no adverse reactions or issues that can happen with giving it.
Oh, wow. Okay, interesting.
Yeah. So even if maybe you come across a person that's not responsive and you don't think that it's opiates necessarily, you could still give it and it wouldn't cause any problems. But if it is an opiate overdose, it will save their life.
Right. Oh my gosh. Yeah. So it's almost like just try it anyway, right?
Absolutely, try it anyway, because like I said, it is the fentanyl is in everything, and people are getting a hold of it. Even if you don't think that your family member or your child is doing it, they can still somehow get a hold of it, unfortunately. So having it on you, having it on your person and stuff, just to be able to empower yourself to be able to save their life.
No, that's such a great point. So it's almost like we should just all have it, maybe even in our purse or in our backpack, or in our house, or at least, right? So that in case something happens, I mean, God forbid.
God forbid, right. I mean, it's so much better to have it and not need it than to need it and not have it. As a nurse, we are always trying to be prepared for the worst case scenario. And it seems like if we have what we need, we won't need it, right? So And it's so much better to have it there and maybe it's a waste and you throw it away after it expires and stuff like that, than to not have it and need it because you had a family or a loved one or your child's friend come over and they got into something they shouldn't have and then overdosed.
Yeah, yeah. So tell me, you said that there's ways to get it for free. How is that possible?
Wonderful. Yeah. So I know at Riverside University Health System in our emergency room, we have a free naloxone program. Anybody can go in, no questions asked. I would like a few boxes of Narcan, and we give it to you for free there. You can also go on to factsfightfentanyl.org, and they have a find naloxone button where you can click on that and it'll have a map for all of your local free naloxone distribution centers.
Oh, nice. Oh, that's awesome.
It is. We give it out a lot at events, just to make sure that we can get the word out to the public and empower them, give them what they need to help combat this crisis.
Yeah. Yeah. What other online tools are available on RUHS's website for parents and educators to really access on the dangers of opioids and, and some of the things we've talked about today?
Sure. At ruhealth.org /behavioral health, we have this great substance use prevention toolbox and treatment services. So on there, it has all kinds of different resources where you can get naloxone, the signs and symptoms, classes if you or your loved one would like to take classes on fentanyl and overdoses, how to talk to your children about it. There's also treatment options as well. We offer a CARES program, and you can call the number and get treatment for yourself or your loved one, or at least some resources for that.
Oh my gosh, perfect. That's great. That's so much great information. Let's switch gears just for a bit. I would love to talk about Stop the Bleed. How is it defined, and how can people become certified in this really essential life skill, Stop the Bleed?
Ooh, I love it. I love Stop the Bleed. I'm very passionate about it. Of course, working in the ER, working in trauma and stuff, we see bleeding emergencies all of the time. We know that bleeding, uncontrolled bleeding, is the number one cause of preventable death for adults and children, really. And we know that somebody can bleed out within 3 to 5 minutes, depending on where they're injured, how badly they're injured. And sometimes our first responders, our EMTs and paramedics, it takes them anywhere from 7 to 10 minutes sometimes to get to where that person that's having the emergency is bleeding.
Right.
So really, so who becomes the first responders?
You.
We do.
Yeah,
we do. Right? Yeah, me, you, the public, right?
Us.
Yes. Yeah. So we do, right? And so what we found is that people don't know what to do, right? They want to do something. They really want to intervene. They see somebody hurt. Our whole nature is to go in there and try to save somebody's life, right? But then they don't know how to do that or what to do, or they're overwhelmed with it. Knowing this, the Department of Defense and Homeland Security really was like, what can we do to educate and empower the public on what to do in bleeding emergencies? So they came up with a curriculum and a campaign called Stop the Bleed, and it's really designed to teach people what to do in that kind of emergency if they're faced with it. So it's a free class. I mean, the formal classes are free. They're about 45 minutes to 1 hour. And it really, you go from, I'm scared to touch somebody, I don't want to do anything, I don't know what to do, to really being empowered, like, wow, I know I can intervene and really help somebody and try to save their life.
Wow. And get certified in this life skill.
Certified.
Yeah.
Yeah. That's what's so great about it too. And things that you can do and kind of little reminders on, oh, I could do that. I didn't know that would help them before. If I could just do that,
Wow. No, that's so cool. I love that. The more you know too, I think about when you're younger and you're going to start babysitting and they say, oh, well, let's make sure you know CPR, things like that. This is one of those skills that really everybody should have.
Absolutely. It's just as important as CPR is bleeding control. And so that's why we really try to go out there and teach anybody and everybody. I have taught over 5,000 people in the community.
Wow. That's a huge number.
Right. I'm so passionate about it though. We say that nobody should bleed to death, and it's so and it's so satisfying to see people go into that class almost scared to intervene, and then coming out of it going, wow, that was such a great empowering class. Now I can really like go out there, and not that I want somebody to get hurt, but I'll know what
Yeah.
to do if they do get
Right.
hurt.
Right. Yeah. Oh my gosh. Okay. So how old do you have to be to participate is question number one. And then I want to know if there's a cost to do this.
Very great. So I have taught anywhere from the Girl Scouts, maybe about 7 or 8,
Oh,
to
wow.
I know they get
So
all
young.
excited sometimes. Yeah, there's like a little bleeding arm that we utilize, and packing the wound and stuff. So they're very fascinated and very curious about it and stuff. So I teach anywhere from 7 or 8 years old to going to some of the senior centers and helping them. So it's really all ages. It just depends on kind of their maturity level and stuff. So and it can be tailored too, right? I'm going to teach the Girl Scouts a little bit different skill set than I would teach somebody else, an adult, something at their level. But the class is free,
Oh,
and
wow.
which is so great to go out there and teach a free class. Sometimes CPR and first aid and stuff, sometimes they charge for it, but this campaign and this class is designed to be free and easy for everybody to accept.
Oh, that's so cool. Okay. So how can people learn more and sign up for this?
Great, I'm so glad you asked. So stopthebleed.org is the official website. You can go on there. You can search for local classes. That's one way to do it. Also, another way to do it, I know myself and a lot of other Stop the Bleed instructors will go to people, right? We just want to teach anybody and everybody. So a lot of companies, their safety divisions have had us come in and teach their employees. We've gone to churches. We do a lot of high schools and stuff. So if that's something that you want in your community, again, you can make an inquiry on stopthebleed.org and say, I would love to have a Stop the Bleed class for my staff. And they will find a local Stop the Bleed instructor to be able to accommodate that.
Oh my God, I love that. Oh, that's so important. I love that it's free. I love that you don't have to be a certain age, like 16 or 18. You could be as young as a Girl Scout. That's so cool. And this is very crucial. I feel like I need to sign my whole family up to do it.
Yes, please. I'll give you my number here.
I
We can go.
know.
Yeah, I've gone to even people's neighborhoods, and just they've had everybody gathered, learn this essential skill, because it's great if you know what to do. But what if you're the one hurt? You want your friends and your
Oh
family
my
and your
God.
loved ones, your coworkers to know what to do, right?
Good point.
Yeah.
Yes, I want the people around me to know what to do.
Exactly. There's been a couple times where I needed the first aid. I was glad that my family members knew what to do. So.
Yes. Oh, well, this is so informative. I love that. I'm going to try to make sure I get all of those websites in the show notes too, so that way we are covered and people know exactly where to go. Also, where they can find Narcan, things like that. Before I let you go, I feel like there was so much valuable information in this. So tell me, what are those three takeaways that you hope that everybody who's listening right now really just it resonates in their head after this?
Really what I want people to take away is that things happen anywhere and everywhere. And sometimes we can prevent overdoses, we can prevent bleeding emergencies, and sometimes we cannot, right? But what we can do is educate ourselves, empower ourselves, give ourselves the tools to be able to help a person in need and save their life. It's really what I want people to take away from this, by educating yourself on fentanyl and opioid overdoses and how to have conversations with your loved ones, and also, educating yourself on what to do if somebody is bleeding to death and stuff. That kind of knowledge and skill set can be translated into the community and into real world application and empower you to be a hero yourself.
Oh, I love that. Yes, yes. Again, key education. The likelihood of an emergency happening around you, I mean, it's gonna happen. It's just gonna happen. It might not be one where you'll need Narcan, but it could be. And why not just have all that education so you're prepared, so your family member or even yourself doesn't have to suffer. So beautifully said. And I have really enjoyed talking to you, Kelly. Thank you so much for joining me and becoming part of our little Covering Your Health family.
Wonderful. It's been a pleasure to do so. Thank you so much.
Hopefully we can have you back on too, because I know that there's so much to discuss when it comes to emergency situations and more. So thank you again for joining me. And well, I know you're a busy woman, so I won't hold you any longer. Go and get that education out in the community.
Yay! Go stop the bleeding stuff. Yeah. All right.